Bismillah, Assalamualaikum warahmatullahi wabarakatuh. So today I'll just be doing an English prompt test or teleprompter challenge to which I've picked a medical terminology teleprompter test, which is an advanced version than the normal English prompter test. So basically what I'm doing is that I'll be reading words that pop up on the screen as fast or as best as possible. So basically I'll have to get the pronunciations right and also not be left but behind with the video. So let's just get started. This is about the procedure of a heart transplant. It may be a bit of a tongue twister because it's about, yeah, it has words that I probably don't have knowledge about. So, but this is telling myself. In In tonight's big news desk teleprompter challenge, we will use as many difficult words as possible to increase the likelihood that you will come across a word you have never seen before. Let us therefore discuss the problems commonly associated with a heart donor heart with a donor heart being implanted within a cardiac cavity. The reason for this highly risky and invasive procedure can be end-stage heart failure, atherosclerosis, or some other catastrophic heart condition or deterioration. However, if the patient currently is suffering from pulmonary infection, pulmonary hypertension, chronic lung disease, or even mental illness, this can make the patient ineligible for this surgical procedure. As part of the pre-transplant evaluation, panel reactive antibodies (PRA), a test is done before allograft. This test will establish whether or not the patient is at high risk for having a hyperacute, hyperacute reaction against a cardiac donor heart. A hyperacute reaction is a strong immune response against the new heart that happens within minutes to hours after the new heart is transplanted. The screening for cytomegalovirus will also be performed. This has serious implications for donor heart recipients. Before a transplant is signed off, an advance directive needs to be signed, which may include a DNR order. When selecting a suitable donor heart HH system, human antigens will need to be examined. Human nucleotide antigens determine the compatibility of tissues for transplantation from one individual to another. Whilst replacing a heart appears daunting, the actual process can be dissected into several simple component stages. A cardiovascular anesthesia specialist administrates the general anesthesia. The unconscious patient is administered antibiotics in order to prevent bacterial wound infections. Machine is connected to stimulate the heart and lungs of the patient, performing a cardiopulmonary bypass. Once the cardiothoracic team are happy there is adequate blood supply, the diseased heart is removed. A donor heart will then be attached to the patient's blood vessels, and the heart is warmed and she'll commence beating. If it doesn't, it can be simulated into beating with a slight electrical shock. Once sinus rhythm is established, the patient will be taken off the heart and lung assist machine. Complications can happen immediately after surgery are bleeding, paracardial tamponade, which is pressure on the heart, irregular heartbeats, reduced cardiac output, decreased amount of blood in the circulatory system. Around 50% of heart transplants develop a coronary artery disease. Around 1 to 5 years after the transplant, another name for this complication is coronary allograft vascular disease and chronic rejection. The patient will need medication to help maintain a regular beat. This can be from 2 to 5 days after surgery. In addition to the regulatory drugs, the patient will need immunosuppressive drugs to prevent the body rejecting the new heart. Foreign matter placed in the body can be seen by the immune system as bacteria or cancer, and so attacks it. Because of our highly evolved immune system, heart recipients will need to take these drugs for the rest of their lives. They will also will they will also have to have regular checkups, including electrocardiograms, echocardiograms, blood tests to check liver and kidney function (CBC), or complete blood counts to check the numbers of blood cells, and also endocardial biopsy. Translated means a small tissue sample taken from the donor heart. This confirms of signs of rejection. On top of this will be palliative care. It is hugely encouraging that 80 to 90, even in every 100 people who undergo a heart transplant will live at least a year. 70 to 75 in every 100 people will live at least 5 years, and 57% of heart recipients will live a further 10 years. One of the reasons patients don't survive is because cardiac allograft vascular. This comes as a result of the walls of the arteries in the heart thickening and hardening. Phew. That will be all for the teleprompter or English prompter about medical terminology. This is an advanced form of English prompt or teleprompter practice, so I'll be sorry if I made any mistakes in my pronunciation because I've seen and read a few words that I probably haven't seen or learned the correct pronunciation of it. So I think that's all from me. Assalamualaikum warahmatullahi wabarakatuh.